Well, hello and welcome to another episode of More Perfect Marketing. It's David Baer here. Today, we're going to be talking about marketing in the healthcare and wellness space. Now, this is an area that I have very intentionally avoided working in for a number of years because as a kid in the 80s, I grew up in a household where my dad was in this industry. And I watched as I would come home from school every day, and he was running his business from our house. Yes, people did that back in those days too. And
Impressive.
he was working with lots of healthcare administrators in hospitals and nursing homes, and I saw the types of programs that he had put together and would teach them things about uh, patient interaction and support and how these things uh, dovetailed with the types of things that we think about in terms of customer service and customer experience these days. And I thought, gosh, this is a complex industry. This is a complex world. And as I said, I've avoided working on projects in this industry for a while, and so I know very little about it. But thankfully, we have a guest today who knows a lot about it. And so I'm so very thrilled to welcome Mike Seyfer, who is I just very unintentionally mispronounced your name because we did this and then we laughed about it in the green room beforehand, but it is not Seyfer, it's Seyfer. So Mike
Well,
Seyfer.
always great to come back to being right. You can't be right the first time, so all the time. But always appreciate somebody that comes back to it.
So thank you for your kindness on that. So I want to talk a little bit about the work that you do because you are running uh, an agency that focuses on the healthcare and wellness space. You're also now taking over leadership of an organization that's very much entrenched in that world in terms of uh, operational and training for people in that industry.
Yeah.
And my observation that I shared briefly with you before we hit record was, gosh, this industry in general seems to me to be a very complex one when it comes to marketing. And here's
Yeah.
what I've observed about this, and maybe you can then help uh, shed more light on what I've gotten right and what I've gotten wrong. But if you think about as consumers, the opportunities that we have to make decisions about what hospital or medical group or specialist am I going to go see? Well, it's often not our decision. It's often that we are being directed by people who are the professionals or directed by what options were given through our insurance company. And so
Mhm.
when it comes to marketing in that space, there's a lot of potential decision makers who need to be marketed to, and they all have to have a different set of messages or put in front of them that are going to speak to the things that matter to them most. And so
Mhm.
that's what I have always found so very complex and complicated about the healthcare and wellness world.
Yeah, it is. I think what you've just described in terms of like most of our experiences are, and the conversations that we get sort of from outside the category are, well, why do hospitals even market? Why do health systems even market? Because your primary care doctor is going to tell you where to go, um, and that's how you're going to make your more advanced care decisions. But in fact, the reality is that now it is even more competitive than it ever was. And so, um, as as consumers, we have a more choice than ever in terms of where we get care. So our primary care doctor may be with a certain health system, but generally our insurers will allow us to go to other places, and we're inundated digitally with more messaging, and we are more curious. We have more access to information, better access to quality scores, what patient satisfaction looks like at different places, what doctor, I mean, you can look up the reputation and the health grade scores of your own doctor, or maybe somebody that you're going to get referred to. So as complicated as healthcare is, there is more transparency and the need for more competitiveness than really ever before.
It's interesting. You used the word transparency, and it was one of the ones that I had written down in advance of our conversation, because I think you're right. There is transparency around things like the doctors and reviews and things that are publicly available online.
Yeah.
But one of the things that I think is a mystery to most consumers in this scenario is what their bill is going to look like at the end of a situation which there's very little transparency around, and that probably is a headache for somebody like you, who is in the role of trying to point in one direction. Hey, look over here, right? These are the things you need to focus on. The money part is something that we really don't want to talk about.
Man, it is like, it's the thing that healthcare, and I mean like the provider side, so doctors, nurses, hospitals, health systems, the thing that they want to talk about least, because they can't even tell you what it's going to cost. I mean, you think about the variables of, let's say, I'm 52 and maybe I've got a knee replacement in my future in the next 10 years. And so I might look at that and, I think it would be reasonable to expect somebody, my health system, to say, okay, this is a $50,000 procedure. Boy, let me look at your insurance based on this. Your coverage, this is going to cost you $7,000 this year, or I would expect my insurer to be able to do that. But that synergy between the two, and then the ability to be transparent with individuals, it just doesn't exist, or rarely exists. And one of the barriers that people have to more advanced care is the fact that this is probably the third biggest financial decision that somebody's going to make in their lifetime. They're going to buy a house. That's going to be in the tens, hundreds, or more thousands of dollars. They're going to send maybe their children or themselves to college, buy a vehicle, tens of thousands of dollars. And for all those things, what you're paying. I mean, what your house costs. They can break down what your mortgage and interest payments are. Same thing for a vehicle. College, what you're going to pay for a year, more or less, until your child asks you for more money. Yep. But then in healthcare, that you're walking into, a $50, $60, $100,000 or more cost procedure, and you have no idea what that's going to cost on the other side. And so it's a real challenge. But also for organizations that actually could embrace it, it would be a real breakthrough idea. Several years ago, we did a study in terms of when we asked people nationwide, what would cause you to actually move from your current doctor, hospital, or health system. And cost transparency was the number 3 thing that they talked about. It was lower on that ranking. First of all, they wanted to know that they were going to get good care, that it was going to be covered by insurance. They wanted to know things like their doctor was really going to listen to them and treat them like a person. But in 2014, when we first did the study, cost was like the number 8 or 9 thing. When we did the study again in 2018, cost had bumped up to like number 3 or 4. And so it is more and more on people's mind. And when you think about the challenges with insurers, payers, people not being able to afford procedures or them not being covered, and COVID has created a sort of all new paradigm in terms of what type of care is covered, for COVID or other emerging conditions. It's created a certain amount of havoc with that price transparency.
And you mentioned as being number 1, is it covered by insurance is sort of lumped in there. And I would say that that's, cost as well, because people want to
Yeah.
know, is this going to be out of pocket, or is it, or something that I'm covering? I want to switch gears and talk a little bit more about my perceived my perception of the complexity of the industry.
Yeah.
Because as I was describing it, I think there's a lot of decision makers and stakeholders in the world that you live in. And I wonder if you can sort of walk us through how you think about those, prioritize those
Hmm.
things in terms of the marketing activities that you engage in. And, really what I'm asking in the subtext here is, what's the strategic approach to what you're
Sure.
doing?
Yeah. It's a great question. And I think one of the fundamental principles is, and you've mentioned the term, I think accurately, uh, in one point of view, the term consumers. Um, we've been in decades of conversations in C-suites and in boardrooms where doctors and administrators are telling us, well, we just have to tell the market that we have this new robot, and they're going to get great surgery. It's going to reduce pain and et cetera, faster recovery. Well, and then we need to get that message out there, because if we tell them, then people will come. And there's a certain disconnect often in those conversations, because remember, you're meeting with people that have advanced degrees, high earners, not maybe typically in the sort of socioeconomic spectrums of the people that they serve. And so there is that disparity. So the point I'm getting to is that we realized several years ago, in about 2016, we had this sort of breakthrough insight that the people we're trying to communicate with are not walking around as patients, every day. So we're not in that sort of consumer mindset in terms of making healthcare decisions. And so, you're going through your day, you've got your job to do, you're on, at 5 or 6 o'clock at night doing your job. Next thing you're gonna go home, maybe have dinner, and like we're trying to manage all these things in our day, and we're not healthcare consumers the way that we're consumers of other products. Like, how many times have we been hit on Facebook with shoe ads, and next thing you know, we're looking at a shoe site, and within 15 minutes we bought a pair of shoes on a whim. Well, that's not the healthcare journey. So we start off with the presumption that we're just people walking around, and so we become aware of our healthcare choices, but we're not active consumers until we have some kind of trigger event. We've got a diagnosis, a pain. We have to actually start thinking about that. So understanding the patient journey along those lines really helps us then think about what that mindset is and how we connect with people digitally to move them from sort of awareness to consideration to decision making. Now, at some point in that decision making spectrum, maybe that choice is out of their hands, or they perceive that choice is out of their hands. But at the very least, in a competitive marketplace, we want to incite people to ask more questions, to bring up things that we know. For instance, if you were diagnosed with cancer, first you're going to go through shock. You're going to see your doctor. Then there are going to be certain considerations that you're going to have about that care that you get. That may be, well, what kind of technology? What's the reputation of my health center? And maybe others have, a cancer institute. Maybe they talk about better care. At some point, you're going to want to know, is that doctor looking at me as Mike, or am I going to be part of the mill? What's the likelihood of my outcome? So we actually do have, for more advanced care, the more advanced our care, the more choices we actually have. But we have to understand how to intersect across the digital spectrum to across that journey to get people to make the right decision.
Yeah, totally. And you've brought to mind, as you were talking about this, a classic disconnect that we see between most businesses and their assumption about what the marketplace, what their prospective consumers or customers might understand, right? And that they
Mhm.
jump ahead and say, hey, all we need to do is tell them that we have the number two whiz bang thing, and they're
Yeah.
going to go, oh, you do, and they'll be as excited as we are. And I think there's a couple of additional layers here, right? There's the fact that these are much more sophisticated topics, and so um yeah, on this show before, listeners will likely have heard me make mention of Eugene Schwartz and the stuff that he talked about in terms of market sophistication and levels of awareness. Well, the market is not terribly sophisticated in terms of the advancement of medical technology.
Right.
And so these are all new concepts to them in a way that, the thing that shows up in the Facebook ad you mentioned, or the
Mhm.
proliferation of a certain ingredient in, over the counter, drugs that are available in the grocery store, right,
Yeah.
are much more common knowledge. So there's some additional challenges here. And then there's the issue of, well, as consumers, we don't invest in prevention.
Right.
We focus on only solving a problem when we know we have a problem, and therefore getting the attention of somebody and saying, hey, there's not as much comparison shopping. There's a lot more quick emergent decision making on the part of the consumer, and then you have that challenge at your end to make sure that you're getting in front of the right people at the right time with the right information to help them make the right decision.
Right. And hospitals and health systems are going through kind of this paradigm shift. I think that they've tried to speak to this idea that we take care of the communities we serve for a long time, but really their business model is based on treating people that are not well, and that need their acute help. But more and more, they want to be in the business of creating wellness, and they need to realign their business model to support people's choices. Because right now, if you or I want to be well, some of the first places we're going are probably to Apple. We're going to look on our watch, and or apps to be healthy. And so that's a whole nother subset of the health and wellness spectrum right now that becomes a real challenge. So if the organizations in your community actually want to live their mission of creating healthier communities, they do it in so many ways, through investments and through quality of care, but creating opportunities for us to adapt a healthier lifestyle, it really becomes kind of a business model shift for them.
Mhm.
So that's another complexity, in that if you think about the care we get, or being well, like, we generally don't turn to our doctors, hospitals, or health systems or clinics to be well. We turn to things like the Noom app, maybe Strava, to measure my workout cycle, or track effort with the Peloton app, or likely just I'm counting my steps on my Apple Watch or my wearable. And so, that's our definition of living healthy, if you will, which just adds another. When you think about those healthcare brands, and I'm talking about the hospitals, health systems, et cetera,
Mhm.
like that loyalty to those other, like the Apple brand, that sort of irrational loyalty to Apple, and that's a compliment,
Yeah.
to Apple, takes us away from the people that should be caring for us. And so those groups are competing with, global brands.
Well, and I think to a certain extent that can be built into a business model of those healthcare organizations. I mean, you think about things like um, Mayo or the Cleveland Clinic, or some of the research medical focused areas,
Yeah.
maybe the UC system or Harvard, where
Yeah. The
they
academic medical
yeah,
centers.
the academic here in Oregon, the Oregon Health and Sciences University. They have an audience of general consumers who because they're education focused, have the ability to get in front of a certain audience, but it's much more limited
Mhm.
than something like Apple or the new map or something like that. And so I think that there's likely, and you know this far better than I do, opportunity. And something in the back of my mind even tells me that like Mayo has collaborated on one of these apps to to sort of get their brand into a wide in front of a wider audience.
Yeah.
But that there's opportunity that I think some are able to leverage, but only to a limited extent because of the focus of the general consumer.
Yeah, without question. I think we're a long way from pairing health and wellness, which we are again managing through a disparate number of apps, and in our overall health, meaning living free of chronic conditions, really severe conditions, extending our lives, which are generally like taken care of by our doctors, our nurses, and other advanced care practitioners. So that disparity, I think, is going to exist for a long time between the sort of wellness and living well, and then being well for a long time and free of more severe conditions.
So let's go back to the question that I was asking earlier about your
Mm,
strategic approach, because I'm thinking about some of the sort of traditional marketing stuff that can be done
yeah,
around healthcare organizations, which are the same that would happen in most organizations, whether it's
yeah.
the digital marketing, content marketing activities. But as I understand it, you're also very active in internally what's going on with an organization in terms of, well, I think I used the term customer service or a customer experience before, or
Hmm.
patient service
Yeah.
or patient experience. I wonder if you can speak to sort of how you approach that strategically as well.
Yeah, well, when you think about the external brand on the marketing side, um, there's that slick veneer of technology, of maybe new facilities and high quality patient, physical patient experience. And then we have that real one-to-one patient experience. So what's our sister company really focuses on cultural transformation and providing the healthcare providers with the skills to enhance their own well-being, to reduce their burnout, to be mindful and present with patients, and in doing all that, they increase their own satisfaction with their colleagues, with patients, and ultimately their ability to really care for people. And that's felt by patients. So that gratitude is returned to them for because it's kind of a paradigm shift over the last decade or so that where people really haven't felt that. And so when we can affect internally the ability for people to have those real human interactions and those real moments of care, then that actually does have external brand impact because we know in any service industry you're only as good as the last interaction. So if you waited for half hour in the waiting room and then another 30 minutes in the exam room and your doctor sort of whisked in and had one eye on you and one eye on the computer filling out the record while they're talking with you, and maybe the conversation yielded, well, let's just get you on an antibiotic or see a couple more weeks, a couple more days what happens and then come back. Like there's very little satisfaction in that versus somebody that really sits down and has a one-to-one conversation with you. So those dynamics exist. And sort of then back to, I think, that the external consumer dynamics. One recent example that always strikes me is we work with a mental health organization, and they focus on treating people with eating disorders. And so, previously we really thought of, or they really thought about engaging their right audiences and talking about food issues. Well, most people that live with an eating disorder, statistically, live with it for up to 7 years before deciding to treat it. And so, going back to how we engage with people, we're not really thinking about meeting people and getting them to buy in the moment. It's very rare that you're going to have that aha moment. based on the first interaction, like a consumer interaction. We need to nurture those relationships and show up with the right messages at the right time. So, for instance, for a lot of mental health disorders, if you think about when that condition proliferates itself, it's often in the middle of the night. We're up, we're thinking about it, we're distressed by it, and so that's honestly a good time to connect with these messages of hope, of some clarity about treating it, and where we found success. But that patient journey is different than maybe a cancer patient journey.
Yep.
And so when we understand the sort of triggers and the barriers and what people are living with, 10, 15 years ago, we would have talked about target audiences, right? We would have talked about a target audience of people experiencing these things that would have been very finite. Well, today it's very fluid, and we really have to understand, what their triggers are, what their barriers to care are, understanding in the healthcare space where the complexity is that the things that may cause me to get care early or seek care early in my journey are different than the late stages where maybe I meet my physician and I don't like that person, or maybe I love that person. I know that they're not as highly rated as another organization, but I believe that person's going to care for me. So understanding those nuances in healthcare and how to, again, sort of show up and have that, back to the previous question about the internal patient experience, meet the external brand perception, like that's more and more critical. And right now, healthcare is probably at a crisis with the number of people that are leaving healthcare, the amount of burnout that nurses and doctors are feeling. And so there's a real opportunity to help heal them.
Well, you're talking about this connection, or the importance of a connection between the external, the promise of the brand, right, and the experience that a patient has in their interaction with the individuals, the professionals, within the organization. The thing that I'm thinking, and that's very common in most businesses, most industries, is that you want to be able to, have that connection so that if, the dentist's office goes to all of the trouble to get that phone to ring and Leslie at the front desk answers the phone and doesn't do a good job of converting that inquiry into a patient, right? That's something that can be addressed, in a small organization. In large organizations like this, at least as a consumer myself of a hospital network, I don't know what that brand promise is. I only know what the interactions are that I'm having with the professionals. And so it sounds like, even though it's important to have that connection, the focus of internally empowering the staff to be ambassadors of marketing, right, is critical.
I actually have to pause, and I'm slightly speechless because you couldn't be more right. And it's one of the things that when we actually think about brand development, like, you can create the most killer, compassionate, resonant external brand, but if you looked at the scale of like when that brand will fail, it would be a faster decline, all based on the belief amongst the people that work for you, the nurses, the front desk, the administrative employees, heck, even the facilities people, in their belief in that brand. And so when that disconnect happens, we worked in New Jersey for several years, and we worked hard to create a really resonant brand and rebuild this brand, and constantly up against, and we actually worked internally for the organization. So we had unbelievable insight into the operation of this health system. And, you couldn't believe that complete disconnect. So no matter how much, how amazing and compassionate video we could create and we could connect with people, 3 weeks later, it would be destroyed by online reviews, talking about, well, those very same brand disconnects. And so when we actually go through a rebrand project with a client, like, we spend a lot of time, we probably spend more time on the internal adoption of it and making sure that those perceptions are aligned from top to bottom. Because again, if I go back to that C-suite or boardroom conversation, the people in that room are getting highly educated, highly compensated people in that community, that probably have a disconnect with most of the people they serve in terms of their everyday lifestyle. So, and when you think about the people within that health organization, it is the facilities people. It's the person. It's not just your doctor that makes that impact. It's the nurse, who's really the frontline employee. But even think about the food service people, the facilities people that you run into, fairly frequently. So when they believe in the brand and they can maybe cite one or two of those brand promises, I mean, not like verbatim, like they're gonna, not like they've got a card and saying, well, here's our brand promise. But when they really believe it, that's when it really works.
Yeah, I'm as I've listened to you talk about this, I'm thinking about, the critical importance of culture in an organization like the ones that you work with.
Yeah.
And how do you, there's one approach to how to create a great business, which is to hire great people, right? If you don't know the great Danny Meyer book, he's a restaurateur in New York City who now has burger joints all over the country called Shake Shack.
Yeah.
His book Setting the Table talks all about how he emphasizes hiring the right people, because you can learn, you can teach anybody how to do the stuff they need to do in that business. Obviously, medical professionals need a certain additional degree of training
Yeah.
in their area of expertise, but hiring the right individuals who are going to embrace and live out the promise of the
Yeah.
organization is critical. And how do you project something like the Zappos approach, or the Nordstrom approach, or
Mm-hmm.
the old Ritz-Carlton approach, right?
Yeah.
Empowering the employees in a way that are going to put a smile on the faces of all the people they're serving, and that can be quite a challenge in many organizations, and I imagine complex, large medical organizations incredibly difficult.
Yeah, and there's so many layers entrenched in that. And I think the single best example I ever heard about like culture really living from top to bottom is it comes from Mayo, and the story that those around Mayo would hear is that anybody can be late to any meeting as if they're helping a patient, right? So people will talk about the fact that they've missed or been late to meetings with the CEO because they're helping a patient. I mean, it could be just helping them get to, where they need to go, some wayfinding, maybe on a conversation with a patient or a family member. But when you really, put that first, and if you live it from the top to the bottom, and everybody knows, like, hey, I think that's one of the clearest examples of
Yeah.
an organization just saying, listen, we put people first, and even if you're meeting with me, the CEO, that you don't show up because you're taking care of somebody, like, all good. That's one of the more striking stories I've ever heard in healthcare about culture.
That's one that's new to me, but now I'm going to be using it wherever I go, any opportunity I have. So,
And I heard it from a Mayo employee who talked about it, so it wasn't like a third degree
mhm.
analogy. And she was fairly emotional talking about it. That conviction exists. Again, if you've ever been to the Rochester campus
Mhm.
here in Minnesota, you know how big this place is and how complex and disparate it is. And then you can go to Phoenix or Jacksonville or the many communities they serve, but that is a universal thing. And she was actually very emotional about it, so it was cool.
Yeah, and which is very telling about the importance that it holds in the organization, I imagine, as well.
Yeah. Yeah.
Mike, but before we wrap up, I want to make sure that folks know a little bit more about the work that you do and your main focus. And you mentioned the sister organization, which you've just also started to take a leadership role in. Tell us a little bit about Haley Sue.
Yeah, thanks, David. Haley Sue's the digital performance marketing for health and wellness brands. We focus across digital platforms on creating patient engagement, acquisition, and throughout their care experience, that advocacy that is so important to thriving brands. And so our team has been doing that for the greater part of 20 years for brands all across the country. And so very proud of that work, and that means a lot, and it fulfills our own purpose of helping to create a healthy world. We feel like our work helps people actually get care that they need, and in doing so, creates healthy communities. And so that's Haley Sue, the Institute for Healthcare Excellence, helps create cultural transformation that leads to greater well-being, capacity, and performance for healthcare providers, nurses, and institutions.
Excellent. Well, I will make sure that we have links to both of those websites. But if you're interested in finding out more about Haley Sue's services and the stuff that you guys do there, don't take the way that we're pronouncing it literally. I'm actually going to spell this out for you so that you can find your way to the correct website. It's HAILEYSAULT.com. And that'll get you over to Mike's website to learn more about his agency. And Mike Seyfer, thank you so very much for hanging out. And this has been incredibly insightful. And I think you've confirmed my suspicions that this is a very complicated industry.
Thanks, David. I really appreciate you having me on here. And again, wonderful to have a great conversation tonight.
Indeed. Folks, you've been listening to More Perfect Marketing. If you know somebody who can benefit from listening to the conversation you just heard, please share it with them. Until next time, my name's David Baer, and I'll see you back here again real soon. Bye-bye.